Good day, everyone. Welcome to our veterinary learning series on dairy animal diseases. In today's video, we are going to discuss one of the most common and economically important diseases of dairy cattle, mastitis. This topic is very important for veterinary students as well as for field practice. Mastitis is a very frequently encountered disease in dairy animals, especially cows and buffaloes. It mainly affects the udder and directly reduces milk production and milk quality. Let us first understand what exactly mastitis is. Mastitis is defined as an inflammatory condition of the mammary gland. It is usually caused by bacterial infection. Due to mastitis, there is a significant reduction in both the quality and quantity of milk. This inflammation may affect 1/4 or sometimes the entire udder, if image shown. This image shows inflammation of the udder tissue, which is a typical feature of mastitis. Now let us discuss the causes of mastitis. The most common cause is bacterial infection. The important bacteria involved are Staphylococcus aureus, Streptococcus agalactia, and Escherichia coli. Other predisposing factors include poor milking hygiene, injury or cracks on the teat, dirty housing conditions, and improper milking techniques, if photo shown. This picture shows unhygienic milking conditions, which allow bacteria to enter the teat canal. Mastitis can be classified into different types. Clinical mastitis shows visible signs in milk and udder. Subclinical mastitis does not show visible signs and can only be detected by tests like CMT or SCC. Mastitis can also be acute or chronic, depending on the severity and duration of infection. If diagram shows udder changes. The first group of clinical signs involves changes in the udder. There may be swelling, heat, pain, and redness. In chronic cases, the udder may become hard or fibrotic, if photo shown. Here we can see swelling and redness of the affected quarter. B. Milk changes. The second group of signs involves changes in milk. Milk may contain clots, flakes, or pus. It may become watery or blood-tinged. Milk yield is usually decreased. C. Systemic signs. In severe cases, systemic signs may also be observed. These include fever, loss of appetite, and depression. Diagnosis of mastitis is based on history and clinical examination. Field-level tests like California Mastitis Test or CMT are very useful. Somatic cell count helps in detecting subclinical mastitis. For accurate treatment, milk culture and antibiotic sensitivity testing is the best method, if CMT photo shown. This image shows the California Mastitis Test, which is commonly used in the field. Treatment of mastitis should always be done under veterinary supervision. Intramammary antibiotics such as penicillin or cephalosporins are used, preferably based on culture and sensitivity report. In severe cases, systemic antibiotics are required. NSAIDs are given to reduce pain and inflammation. Frequent milking of the affected quarter is advised. Strict hygiene must be maintained during treatment. This treatment information is for educational purpose only. Prevention is always better than treatment in mastitis. Proper milking hygiene should be followed. Teat dipping before and after milking is very effective. Housing should be clean and dry. Dry cow therapy helps in preventing new infections. Regular screening using CMT is important. Good nutrition helps improve immunity. Mastitis causes heavy economic losses to dairy farmers. It leads to reduced milk production and poor milk quality. Treatment cost increases. In severe or chronic cases, early culling of animals may be required. To conclude, mastitis is one of the most common and costly diseases of dairy animals. Early diagnosis and proper management are the keys to control this disease. Preventive measures play a major role in reducing its incidence. In the next video, we will discuss hypocalcemia, also known as milk fever. We will cover its causes, clinical signs, diagnosis, and treatment in detail. So stay connected and keep learning. Thank you for watching this video. If you find this content useful, please like, share, and subscribe to the channel. This is